Hi, my name is Dr. Dev Manager, Medical Director of Vivace Health. This video explains how I use as a sleep physician medicinal cannabis or cannabinoid therapy in those with sleep disorders. When I see a patient who's been struggling with their sleep or have something called insomnia, there's a few things I really need to know about that sleep or lack of sleep. I need to know obviously if it's difficulty in getting to sleep, staying asleep, or early morning awakening, and obviously how much that impacts on the well-being in the day, particularly fatigue, tiredness, concentration, focus, and general mood. There's 4 quadrants, as I call it, of patients. The first group that I see very commonly is those with busy brains or a hyperdrive type of sleep, that flight, fright and flight and can't switch off, that cortisol flying around in the brain. And these patients are those with anxiety or mental health issues, PTSD, ADHD, bipolar. The second group of patients that I see commonly are the fragmented sleep. They just can't get to sleep and stay asleep, and it's very broken sleep. It's like chopping up their sleep, like chopping up a cucumber. It just really is not restorative. And this type of sleep is very common in those with chronic depression, neurodegenerative disorders such as Parkinson's disease, and also very common in dementia. The third group of patients that I see commonly are those with restless sleep, those who sleepwalk or have night terrors or nightmares or restless legs, or they can't get to sleep because they're out of sync with their sleep cycle, something called delayed sleep phase syndrome. These restless sleepers have terrible issues with regard to the sleep and fatigue and tiredness. And they're another big group that I see, particularly in the younger age group. And then there's the fourth group, the noisy sleepers. Those that snore a lot, have sleep apnea or they stop breathing, but they may also have issues with hyperdrive sleep or fragmented sleep or restless sleep. Generally, when I'm considering medicinal cannabis in these patients, if you're a hyperdrive asleep, these groups do very well on CBD oil or cannabidiol. What CBD oil does, it just reduces that flight, fright and flight and reduces that ready, steady, go feature of their sleep. Those who've got quite severe fragmented sleep, I do add on a little bit of THC or Tetrahydrocannabinol to the CBD just to further consolidate that sleep. But the CBD is very important again to just improve that and settle that busy brain that they may also have. The third group, the restless sleepers, if there is anxiety that's driving the night terrors or the sleepwalking, then I do tend to start off with CBD. But many with restless legs have chronic pain, and chronic pain is another very common issue with those who can't sleep. It doesn't go away when the sun goes down, and those patients of mine do very well with CBD with a little bit of THC. THC is very good for chronic pain, but if you've got the neuropathy pain like sciatica or shooting pain down the arms. So a combination of CBD and THC for those restless sleepers can work very well. And then the final group, the noisy sleepers, those who have sleep apnea still may have anxiety and just quite can't settle that brain down to get into the groove of sleep. And for those that are trying to get onto CPAP with the mask, it can be very difficult. So in those patients, I actually start off with CBD oil, get the hyperarousal state, the busy brain quieter, and then maybe a few weeks later, go onto the CPAP machine. And as a combination of treating the sleep apnea and the sleep disturbance, these patients do feel a lot better. So in those 4 groups that I've mentioned, certainly medicinal cannabis is worth considering, and if you're one of those that you think I can benefit, then certainly doing a sleep test. Give our team a call, Vivace Health, or 1300 459 310, and they'll speak to my team with regard to getting a sleep test to understand better about your sleep. And let's not forget, medicinal cannabis can also reduce the need of other sleeping tablets like benzodiazepines, and I've had a huge success in getting people off those drugs like temazepam, zopiclone, Stilnox. So look no further, and let's get lives lively and get you sleeping well, and give Vivace Health a ring today, and let's make lives lively. See you next time.